Thank you, Chairman Moran and Ranking Member Merkley. Dr. Woodcock, it seems like every few months we hear about another pharmaceutical company raising the cost of a certain drug or device to a new astronomical price. The EpiPen Auto-Injector is the most recent to draw national attention. The EpiPen has become so expensive that families in my home state of New Mexico and across the country are struggling to afford it, even though their doctors say they must carry it in the event of an allergic reaction. But Mylan, the manufacturer, has increased the price of the EpiPens in the United States by over 480% since 2009. And I've received messages from many of my constituents in New Mexico who are directly impacted. I've heard from worried parents across the state. One of them, like a woman named Paige Vest from Truth or Consequences, New Mexico. Her daughter suffers from a severe peanut and tree nut allergy. She needs to carry an EpiPen with her at all times to prevent a possible life-threatening reaction. Paige wrote to me about her family's struggles to pay for the medication. She even had to change jobs in order to get insurance that would help cover the costs. You know, change jobs in order to get the medication for her child. And I'm also worried about the impact these price increases will have on families who can no longer afford the EpiPen. Linda Thompson from El Prado, New Mexico, wrote to me that because of rising costs in recent years, she has stopped buying and carrying an EpiPen. She's forced to go against the advice of her doctor, who prescribed the EpiPen after a severe reaction to a bee sting. So no one should have to go without a medically necessary product because of how much it costs, and that's why I wrote to Commissioner Califf last week, along with members of the New Mexico congressional delegation, requesting that the FDA utilize all available resources to build a robust pipeline of EpiPen alternatives. And you know, listening to those constituents, I'd like you to answer for them, because I think the real question they have of you and the FDA is, how did we get to this point? How, you know, what happened to create this situation? How we got into a monopoly situation that we're talking about? And could you just describe that as simply as possible, how you think we got here? And isn't it terribly troubling that this company now is further trying to encroach into the market because they're apparently going to put out a generic, and so they're trying to keep the market to themselves. They have their own EpiPen that's brand name, but then they're going to put a generic out on the market. So could you try to answer that as simply as possible, that how did we get here?
Well, for most drugs, once they lose their patent protection, and so they can have generics. Most drugs do get generics, but some drugs don't. Either they have large market, they have patents that say in this one, the EpiPen has patents that go through 2025, and so it's not easy to make a generic that doesn't infringe upon those patents and still works. All right. In other cases, it might be a small market. I'm talking about for other patients in New Mexico who've seen price rises, or a single source drug. In other words, only one company sells it. And so in all these cases, they don't have competition. And in the United States, that's what keeps prices down, is competition. And so for many of these situations, when we've looked, there's some reason that competitors have not effectively entered the market and brought the prices down.
And what is causing that? Because you said you've approved 4 of these, and yet, as Senator Merkley asked, you know, why isn't somebody stepping up and saying, you know, there's a lot of money to be made here? What is it? Who do you point to say what's caused this monopoly situation that has these astronomical prices?
Well, there is one other competitor to the EpiPen on the market.
Yeah,
right?
this Adrenaclick.
Yes.
Yeah.
Several others were pulled off for performance. One was pulled off for performance problems. One thing you for a drug like this, in a situation like this, you want it to work. So you don't want to say, well, FDA should rush something through even though it might not work all the time. Because if that were your life that were at stake, you'd want it to work every time. So we have to make sure that if there's competition here, that it still works as a epinephrine auto-injector, and it's going to deliver the life-saving medication when we have a life-threatening anaphylaxis happening.
Yeah. Mr. Chairman, just to wrap up, you mentioned the patents over and over again that seem to be part of this, and I think, I know it's not in the jurisdiction of this committee, but I think that's something we really should be looking at, is what the patents are doing to create monopoly situations. But we appreciate your service, and thank you very much for being here today with us.